Hi, welcome to the video where we're going to be discussing future state mapping. With me, my name is Brendan Weil. I'm one of the lean coaches, and I'm off camera doing this recording. And with me is Kevin DeHorty, who is one of the other lean coaches. So we're both going to work together, walking through these slides, providing you some examples as we go along. And then, just like with every other one of our video modules, we're always available for you anytime to answer any questions that you might have. So as we move forward, the first thing when we start to think about future state mapping is to really think about what makes up a lean value stream. And we've broken that down really into four categories that we want you to think about as it relates to the transition from your current state to your future state. So the first one of those is value. And this one should really be come as no surprise to you to have included here because we've talked about this so much in our previous modules. But just it's critical to understand, if you haven't done so already, the value of your process or the value your process provides to the customer. So if during your SIPOC you did not identify your customer and their requirements, or if during current state mapping you didn't do it, this is your third and really final chance to make sure you fully understand those customer requirements so you can make sure that you incorporate them. So we'll talk a little bit more about that here in a minute. The second one is around flow, making sure you're doing everything you can to either eliminate or minimize both the waiting and the rework that's built into your process. So we consider that building flow into your future state. The third one is all around the work itself. And when we say work, what we mean is thinking about where are all of the opportunities to standardize our various work processes, and in doing so, build quality into them so that we're minimizing as I should say, improving our ability to build in the first time quality. So if you recall in our current state mapping, two of the big measures we talked about were lead time and first time quality. So when we think about flow and standardized work, those really are going to be our two solid approaches to go after improving the lead time as well as increasing the first time quality associated with our processes. And then the fourth category is managing for improving and learning. And that's really making sure that we've built in appropriate milestones and checkpoints into our process, and that we've identified a way to embed learning or a continuous improvement into what it is that we're experimenting with or changing in our process. So let's walk through those and talk about a few examples as we go along. So the first one again, this one you should be pretty familiar with by this point, but thinking about the definition of our customers' requirements. And it references here our critical questions, and these are just like they were in our SIPOC and in our current state mapping. Who are the customers of our process, and what do they really require or value from the work that we're doing? And so this is your opportunity to rekindle that from your previous work. And as I mentioned, if you haven't done so already, to make sure you're doing it. And then as you create your future state, making sure that you're deliberately checking back on these to assure that you've built these elements into your process and that you're actually delivering that value that you've identified. And then as we go along, we've got a handful of different starbursts that'll bounce up here that'll reinforce some of our key points. This is one that'll really be unnecessary for me to reinforce, as we've talked about this already, as it relates to referencing back to your SIPOC. So then we want you to be able to take a step back. So before you actually dive into creating that map, is to think about what approach you're trying to take in your development. Are you going for a radical redesign, one in which you're going to blow the whole thing up and start over, and along with that are going to have a pretty long lead time to get it all in place? Or are you looking to do something in a few critical steps in your process, or something that's going to build up to eventually be a radical redesign? It's important that you understand and you have agreement from your sponsors on down to your team members which approach you're going for. And that way you can better manage the different interventions that you want to try to do. Or whether you're starting with a total blank sheet of paper, or you're starting with your current state and then optimizing some of your different problem areas. So once you've made that determination, the next section that we talked about was around making the work flow. Some of the questions that you can ask yourselves, or ask your team can ask itself, I should say, is do you really need all of the steps that you have outlined in your current state? How can you avoid and eliminate the delays and the interruptions so that the work begins to flow? Okay? So if you remember when we talked about waste, and in the videos on waste, we talked about our ham story. And if you remember the ham story, the question on the ham story was, we have a lot of short pans in our institution, and we've continued to do work in a similar way for years and years and years, and we've never stopped to question it. This is your opportunity to think about that analogy that we told in those previous videos and try to apply it to your current states. Think about all of your steps. Are the things that we're doing because we've always done them that way? And this is your opportunity to challenge that. Talks about your key lean concepts and tools. So where can we combine work? Where can we cross-train folks to do multiple jobs within and across that value stream? The second one, it refers to adopting service level or proceed until halted agreements. And this one's really important. This is one where when we start to go across our value stream, where we're jumping out of our silos and into other departments or other services processes, making sure that those departments or services understand what your department's requirements are of their work. And then you can begin to adopt what it's referencing here as being service level agreements or service level contracts with them, in that they acknowledge that you need something, say, in 30 minutes, and they make a promise to you that you will have that value delivered. You will receive that product in 30 minutes at the quality level that you've identified. So that's one of our ways that we begin to acknowledge our customers that we have internally, in addition to those that we have externally, our patients and our families. Number 3 refers to adding other lean tools. This is your opportunity to go into your toolbox, think about other lean tools that you might be able to apply to the process. And then number 4, adjusting rules for prioritizing work between steps. So again, thinking about how we prioritize the work that we're feeding others. A great example that we might use for that, and this also kind of connects to number 2, would be in our labs, where if you have a specimen coming from the ED on a trauma patient, it carries with it a higher level of urgency. It's prioritized in a different way than a specimen on an inpatient who's in stable condition. So it's important that if you have work that follows a similar need for being expedited in that manner, that you have those conversations with those departments and you build those rules into your future states.
An example with an ambulatory care might be if a patient comes in on a stretcher for an appointment, and the service level agreement that we're looking to move towards being the standard is that they're prioritized first. That there's a room waiting for them, and that HVA can actually stay with that patient and get them in and out as quickly as possible.
Another great example, and I think it goes back to your team in the future state reflecting on your workflow and answering the question, are there types of patients, are there types of services that we deliver that do require a higher sense of urgency? And this is that opportunity to create those service level contracts to ensure that those are met. So that's a great example. And then this Starburst here just refers to some of those other lean tools that are available in your tool belt. So things like standardized work that we'll talk about, 5S, error proofing, quick changeover, and load leveling. Many of these lean tools, if there isn't already a video on them, there will be soon. So I would say that as you're going through and pulling materials on these, there will be more information available to you on this site as well as we go forward. So common barriers to flow. So these are some of those things that will stand out to you. You've most likely flagged these things with tornadoes in the development of your current state. So some of those things, having too many handoffs, fluctuation in the work requirements, whether it be due to complexity or due dates or the size of the work to be done, fluctuations in the pace of the work, so you have more work at 10 a.m. than you have at 2, and then you have twice as much work as you did at 10 a.m. at 6 p.m. Those high levels of fluctuations and variability in your workflow that are a barrier to having nice even flow across your process. Waiting for decisions or approvals from other departments or groups or even folks within your own department. Having long queues, long waits to get something done. Having processes full of interruptions where work can't be finished or completed. Having lots of rework built into your process. And just in general, having poorly defined requirements across all the functions. So again, a connection back to requirements, both in the job being performed, but if again, thinking broadly about why we're doing the work we're doing, is what is the requirement of the customer for the work that's being done? If we're not defining that clearly, we're getting the results that we would expect from it, right? If we're not clearly defining the requirements, it's not surprising that we wouldn't be meeting them. So again, that's definitely a problem we'll want to think about and address as we're reflecting on our current states. So this just now shows us some of the typical countermeasures to those. So too many handoffs, thinking about combining steps, fluctuations in work size, establishing a separate standard process for that special type of work, those service level agreements that we talked about. Fluctuations in the pace, taking steps to standardize the pace. A lot of times when you're trying to standardize pace, you may never be able to level it out completely, but what are some things within your control that you can do to even it out? Challenge your teams to really think hard. Oftentimes the elephants in the room or the big political monsters that no one wants to tackle are typically tied to the decisions we have to make in order to address how we might level the pace in our processes. Waiting for decisions or approvals, adopting proceed until halted agreements, meaning we're going to keep working through a process until we reach a step that truly requires a decision or approval. Having long queues, implementing quick changeover. From a simple definition standpoint, quick changeover is reflecting on your process and thinking about which steps in that process can begin to be performed in parallel to other steps. And by doing so, by making a process less linear, so in other words, counting 1 to 10 in process steps, instead of doing that, counting 1 to 5 with 5 steps happening in parallel, we're able to dramatically impact our lead time. This is used oftentimes in our ORs as it relates to room turnover and case prep and case setup. As it relates to interruptions.
Can I just step in here?
Yeah, sure, absolutely, Kevin.
Just joke. It was a bad joke for the interruptions. Please continue.
Nice. Well played. So as it relates to interruptions, putting in processes to manage those interruptions.
So for instance, I'll raise my hand next when I want to talk. So that'll manage, and Brendan can call on me versus me cutting in on him.
That's an excellent example. Other departments have gone so far as to hang stop signs on cubicles, like little shush signs on doors, anything at all to be able to make it visual to the people in the work environment that they should not be interrupted. A nice clinical example related to nurses who were preparing for med pass, that while they were doing that very critical task, they actually were wearing, was it Kevin, a different colored...
A lighted lanyard.
Or a lighted lanyard, that's what it was. A lighted lanyard that indicated that they were in the middle of preparing for their med pass and that they should not be interrupted.
Although there is a group in the cancer center that does wear a different colored vest when they're delivering or passing certain chemo medications.
So again, the whole takeaway from that, right, is a visual indicator that's different, that stands out from the norm, that everyone understands the definition for it. And in their case, it was attempting to reduce the interruptions, because the study showed that interruptions lead to med errors. And it's an absolutely critical thing that we need to be able to reduce and to be able to impact. And that's one way that they went about trying to do that. As it relates to rework, developing standard work with appropriate corrective actions in order to minimize the ability for errors to occur. And then again, that poorly defined requirements across all the functions is truly understanding what the customer's internal and external demand from a process, and then whether it be through service level agreements or your own agreements to the teams that you're servicing, the patients, the families you're serving, building processes to meet those requirements as often as possible. So the third step just then talks about the development of built-in quality in your process, as well as standardizing work wherever possible. So again, the critical questions around this step were: how can you structure your work to deliver 100% correct and accurate to your downstream customers 100% of the time? And how can you begin to spot problems immediately and visually in that work environment? So kind of some of the key lean tools and concepts for that. Obviously the first one, the big one, being implement standard work wherever you can. Building in quality into the process at the source, so where the work is happening, build the quality into it. And wherever you can, make elements of the process visual to the people who do the work. And then our little starburst here is just a nice little reminder to you that when we see correct and accurate on this slide, It actually connects directly to what we framed in our value stream mapping as FTQ, or first time quality. We're basically saying the same thing. So this is where, as you're looking at your current state map and you're seeing lower than you would expect first time quality, you may have even flagged it with a tornado. This is that step when you really start to reflect on what you're going to do in your workflow in order to improve that dramatically in the process.
I think we're going to make this part 1, and we'll actually pick back up in part 2 in the next video.